Hi, this is Dr. Ami Bera, your representative in Congress. Thank you for joining my live telephone town hall this evening. Tonight we're going to have an important discussion with Dr. Peter Bielenson, who's our Sacramento County Health Director, on the recent surge of COVID-19 cases in our community, the latest public health orders, and also what we're looking at from the state and federal level. It'll take a few minutes for us to call into all the households we're calling into this evening and get everyone on this telephone town hall. But if you'd like to ask a question at any time, go ahead and press 0, and that'll put you in the queue. So while we wait to get everyone on this call, let's just talk a little bit about some of the things that are happening in Washington, D.C. This pandemic really has been unprecedented for all of us. It's not just one state or one community; it's the entire country. And we've seen, we did really well here in Sacramento County in March and April. But as all of us, and I'm sure Dr. Bielenson would concur, we know the virus has continued to circulate. And as we reopen, we've always anticipated there would be flare-ups, and we're going through one of those flare-ups right now, and, as we all work together, there are things that, we'll cover this evening that we can do to help slow down the transmission of the virus, help protect one another, and protect our vulnerable populations as we go through this. At the federal level, we know the pandemic has also impacted a lot of individuals financially. I will be flying back to Washington, D.C., we do think we need to continue extending unemployment benefits. We need to continue making sure people can cover their basics, food, shelter, clothing, and just the basic necessities that everyone needs. And again, this is a time where we have to come together as a country, a region, a state, and really look after one another. And, it's going to be extremely important. People are still calling in, and we are still calling out. But if you do have a question at any time, go ahead and press 0, and we will try to get through as many questions as we can. And then also, we are constantly trying to get information out to folks on the latest that's happening with the pandemic, but also other ways our office can help. If you're not on our email list and you would like to get on our email list, go ahead and press 1 at any time, and that's the best way for us to get information to you and get the latest of what's happening. Why don't we, Dr. Bielenson, if I were to turn it over to you for a couple of minutes, if you want to just give us an update on what we're seeing here in Sacramento County. And you might have to unmute yourself.
Thank you very much. I forgot about the mute. Thank you very much, Congressman Bera, and thanks for having me on again, and hello to everyone on the call. We're at 6,400 cases now in Sacramento County. To put that in perspective, we had 2,000 cases total in the first 20 weeks of the outbreak, and we've had about 1,000 each week for the last 4 weeks or so that have gotten us up to this number. In and of itself, that doesn't mean terribly much. We're actually lower per capita than many of the major counties. But we are also concerned about the hospitalization cases and the ICU cases. And so we've gone from 8 hospitalized cases about 5 weeks ago to 184 this week, today. So we've gone up about 19-fold. I think that's about right. And 58 people in the ICU as opposed to 2 in the ICU before. So the thing that we're most concerned about in terms of the number of cases, I'll get back to the number of cases and where we're finding most of them, is to try and keep the people out of the hospital and the ICU to keep from overloading those 2 entities. So to that end, we have about 20% of our ICU beds available still in the county, which is reasonable because we also have 657 surge capacity beds that are there in case we have a surge to be able to cover them. And all 657 of our beds in the county are still to be used. And that means they're also fully staffed if we needed them. So we're not in a terrible situation, but we're clearly in an increased risky situation compared to where we were 4 weeks or so ago. Let me talk briefly about the number of cases and who they are. They are predominantly young people. 70% of our cases now are under 49 years of age, and 70% of them have been under 40 in the last month or so. So these are predominantly youngish people, a lot of whom are asymptomatic or don't have symptoms, which is good in some ways, but bad in other ways, because if they don't get tested, they can be shedding virus without knowing it and can spread the disease and can be known as what are called super spreaders. So we're trying to make sure that we're testing people who are both symptomatic and asymptomatic in order to find out the folks who are potentially spreading the disease. And to that end, we use a lot of contact tracers. We have 40 on hand right now. We're going up to about 100 in the next 3 weeks. And the contact tracers do just that. They trace the contacts of individual cases. Then they find out who they've been exposed to and get the case treated and get the individuals who've been exposed to the case quarantined for a period of time. And the idea is to kind of squash the outbreak before it breaks out. Unfortunately, we have so many cases that our contact tracers are somewhat overwhelmed right now. And that's compounded by the fact that the testing is, as many of you may have found, extremely long in terms of turnaround time. So right now, the turnaround time from most of and I'll have some good news in a minute, so I'm just getting the bad news out of the way first. The turnaround time now for most of the major commercial labs like Quest and LabCorp, which is the labs that most doctors' offices use to send tests, the turnaround time is 8 to 9 days. And as most people are now fully well aware, if you get, let's say you get tested 3 weeks after you first come down with the illness, and 3 days, after you come down with the illness, and you have another 8 to 9 days turnaround, is 12 to 13 days after you've been infected, and by that time you're basically done with your quarantine. So it's basically not worth terribly much information to be had by the tests. That being said, we've just developed a deal with a local lab that has turnaround time of 2 to 3 days max, where we'll be able to do all of our 5 community-based sites, double the size of them, and do 5 additional community-based sites starting next week with the 5, and then another 5 in a couple of weeks after that. So we should have a better turnaround time, which will enable us to serve our population better. So let me stop there and take questions if Congressman Bera wants me to, or we can wait for later on. But that's where we are in terms of cases, hospital cases, ICU cases, testing, and contact tracing.
Great. Thanks. And if you have a question, go ahead and press 0, and we are starting to get questions. So let me go to the first question from Donna in Citrus Heights. Donna, are you on?
Hi, Dr. Bielson. A couple of weeks ago, I talked to you on a call like this, and I asked about wearing masks, and you said,
yep,
that we should wear masks. However, yep, I was just invited to a group of women, and I said, well, are they going to be wearing masks or not? She said, I can't tell you. So I didn't go, but I found out that there are 11 women at this Bible study group, and no one wore a mask.
Yeah.
And it really bothers me because this isn't the first time. If I go into a store, I'm so outspoken. If I see someone, I'll say, did you forget your mask? And they turn around and look at me and say something sarcastic. But you know what? There's signs up that say you must have a mask on to enter, and I don't know how it's being enforced.
Okay.
How can it be?
Yes. So we're now 2 or 3 weeks into the mandate of wearing masks. On the good side, I'd say that I've been to probably 30 or 40 businesses, from grocery stores to restaurants to pharmacies to hardware stores, and virtually all of them, I've got to tell you, virtually all of them, 99%, if not 100% of the people are wearing masks, both clients, and staff. That being said, you can call 311 to report cases where they're not behaving well, if you will, and we collect them every week and divvy them up based on how many calls people are calling in about the place and what the issues are. And literally, I go out. So, for example, I won't say the name of this gym, but there was a gym that was not requiring masks in a part of town. I went to them, said, "You've got to behave. You've got to use masks." And they said, "Well, our manager is not saying that back in Nebraska or something." And so we called Nebraska, and they got on the line with them, and they made sure they now mandated. Otherwise, we were going to shut them down. So we can go all the way to shutting places down if that's the case. So I would a long answer to your question in that since we mandated the masks, I've noticed a lot more people are wearing them because it's depoliticized the issue to some extent. Secondly, you can call 311, particularly on a store where they're not requiring the masks. And finally, in terms of gatherings, which is still the major cause of infections in this county right now, it is gatherings of extended family and extended friends, that if you know of a place that's going to do that, that's not going to wear masks, please let us know. And we don't go out to enforce or to shame, but we go out to educate and tell people that they really have to wear their masks if they're going to prevent the spread of the virus.
Yeah, and if I could just add onto that, we're all in this together, and I know there are folks that say, well, this is my civil liberty, I can choose to do whatever I want, but we're facing probably the biggest challenge to our country and our world that we have in my lifetime. And if we work together, if we take the politics out of it, if we don't say, this is it's a virus. It's not a Democratic virus or a Republican virus. The virus doesn't know what religion you are or what your country of origin is. It's just a virus. And, we know things that we could do not to just protect our neighbors and our parents and grandparents. Wearing that mask does do that, but it also, the evidence is starting to suggest that it does offer you some protective qualities as well. And, it's a small sacrifice for all of us to take those cautions. And, it is going to be hard for all of us, and potentially, unfortunately, the fall and winter could also be difficult when you have the flu circulating. And this is a place where we've all got to be together and look after one another and do our parts. So wear a mask when you're out. Practice physical distancing when possible, and obviously good hygiene. Wash your hands. So 3 important steps. We've got a bunch of questions. So, again, if you have a question, we will try to get to as many folks as you can, and just press 0. We've got a question from Daniel. Daniel, are you on?
Hello,
Daniel.
Can you hear me?
Yeah, I can.
Yes.
Awesome. Thank you so much for your time. So I have a question regarding while we wait for a vaccine, which could take, well beyond a year before we have an effective one. Is there much consensus in the scientific community regarding ways we can improve our immune system in the meantime, just through diet and nutrition and other ways to help combat COVID-19, as well as wearing a mask and social distancing? So I guess I'm just wondering, is there much talk? I've seen some things online with some studies that help, infectious diseases decrease is improving the immune system. And I'm wondering if there's much we know about that regarding nutrition and health, as well as the other parameters to be taken.
Certainly, I'll put my doctor hat on and take a first crack at it, and then Peter, if you want to add some things. Sure. Certainly, a good diet, exercise, and if you are very helpful at keeping you healthy. If you have a chronic condition like diabetes or hypertension, making sure you're doing everything in your part to try to keep that under control and well controlled, because we do know some of those chronic conditions do put you at higher risk. So the more you can manage that, is the better. And then, there's the direct threat of the virus, but we do know that the mental stress that people are under because of the stay-at-home orders, the inability to be with your close family and friends, to hug your grandkids, that does take a mental toll. And the more you can try to recognize the mental stress that people might be under, and look to the tools that allow you to safely interact with your loved ones and your friends and your Bible group or church, using tools like Zoom, et cetera. It can't replicate the physical presence of being with your loved ones. But in this time when we know the virus is circulating, we really do have to take those cautions. It is interesting, Daniel, you talked about the vaccine. This is the fastest I've ever seen science move. Now, I don't know that we'll have a vaccine before the end of the year, but the study and the data that's coming out of some of these trials look promising. We want to make sure whatever vaccine does come out is safe, and that it's effective, and it could be early 2021. But again, the scientific community is moving pretty quickly here, and I think all of us in Congress, along with the president, are putting a lot of resources in trying to get that vaccine developed, and this is a place where we all have to work together. Peter, do you want to add anything on?
Yeah, a couple of things. First of all, if the single probably most important thing you can do is, if you smoke, stop smoking, because respiratory conditions, which are obviously exacerbated by smoking, put you at significant increased risk no matter what age you are for the virus. And I would agree with the congressman. The rest of it is basically everything in moderation: good, healthy diet, good exercise, and trying to keep your chronic conditions under control as best you can. I would point out, in terms of the vaccine, I think it's crucial that we start thinking, if not before now, at least now, on how we're going to distribute the vaccine. So it's one thing to have a vaccine that works. It's another to get 7 billion copies of it, if you will, at least, maybe even 14 billion if you need to. So we've got to be making sure we get the little ampules ready, all the kinds of things that we weren't ready for, mostly because of the federal government, not Army, but because of, whatever. And anyway, in terms of testing materials, in terms of PPE, those kinds of simple things, we need to be working on them now to make sure that they're available, so when we have a vaccine, it can be put out to the folks that need it immediately.
I can agree with you more, Peter. We're working with the global community and some international organizations to answer those very exact questions, because we know we don't defeat this virus if we just vaccinate 300 million Americans. It is, as you said, 6 to 7 billion people around the world, and it's a monumental task, the logistics, having the syringes, the vials, all of that. So we are working on that right now, so we're ready to hit the ground running when we need to. And the other thing that I would put out there, since we are talking about vaccines, one thing we can all do to help us get through the fall and winter is to make sure you get your flu shot. And we are working with the CDC to actually ramp up and try to get an extra 50 million doses of the influenza vaccine, and trying to work through the logistics of having multiple places that are convenient where people can go and get their shots, as well as trying to figure out how to make sure that shot gets covered so you don't get a bill for it. So incredibly important, and that is one thing that's absolutely in our control to make sure we get the influenza vaccine. We've got a bunch of questions, so let's go on to the next question. We've got a question from Alana. Alana, are you on?
Hi, my question really concerns the disproportionate rates at which Black communities and some Latino communities as well are experiencing the most severe consequences. I know Peter mentioned if you're smoking, stop, because that contributes to respiratory issues, and so does pollution. And so I'm just wondering, what are you doing to address that? Seems to be a very significant factor, because most of the Black and Brown communities are in toxic hotspots, polluted areas, to curb that, because industry has certainly been asking to roll back that in mind.
Yeah.
Peter, do you want to start on that?
Yeah, I'll get that. So the interesting thing is, and actually we have pretty good data on this now because we have 6,300 cases, the Asian, NHPI, Native Hawaiian, Pacific Islander, and Black populations all are actually about their amount. They're in their segment of the population that they are by population, if you will. So in other words, 14% Black, that's about what our county is. Asian is about 12% of the cases and about 14 or 18% of the county population. So what we actually have right now is an overrepresentation of the Hispanic population, with 36.6% of the population of the illness compared to about 18% or 20% of the population. So they're overrepresented. And so one of the main things that we're doing, which we've just started about 3 weeks ago, is having community-based sites based on sites of people of color and vulnerable populations. Again, where we started with 5 of them, we ran out. UC Davis ran out of reagent, ran out of materials a week or so ago. We were able to sub in the National Guard, and now we have a new deal with a local lab that'll be able to do vastly more testing in 5 additional places. So we basically are going to Hispanic, African American, and Asian Pacific Islander sites almost exclusively in our 5, and in our 5 additional ones, we'll be covering up a bunch more of those sites. We test the asymptomatic as well as the symptomatic, which was important for for the reasons I was giving earlier, and it's been a real boon for the organizations that have been co-sponsoring it for us. Not a boon, but a real benefit to them and to the communities. So I think that's the main way that we're getting it. We're testing many more people at the community level in communities of color.
And Alana, I would just add, Alana, that when we look at the national figures, we do know the African American and Latino communities disproportionately have been impacted by this virus. Part of that is access to healthcare services, also higher incidences of diabetes and hypertension and other comorbid conditions that make them particularly vulnerable. So when you see the hospitalizations and unfortunately some of the death counts and numbers, those are communities that have been hit pretty hard. In addition, the economic impact of the shutdown and the pandemic has disproportionately hit these under-resourced communities. So at the federal level, we really are thinking about how do we get resources directed to particularly healthcare resources, but also some economic resources to these communities that we know that are suffering a greater burden. Some of it is supporting the efforts that Peter's doing here in Sacramento to get increased testing sites in these communities. We also, from my end, I've been pushing that we should make the tests available at no cost because we want people to get tested if they have symptoms. We'd actually like to get the treatment and therapies covered as well, because until we take care of the folks, we'll continue to spread this virus, and we don't want cost to be a barrier of people who are symptomatic coming in. So,
if I could add one thing, Ami, the Hispanic and Black populations particularly are a lot of the service provider in terms of important services to critical infrastructure, so they have to continue working. And there's been a big increase in migrant workers and day workers, and particularly in the Latinx population, because they only have their daily wages for sustenance, they may keep working. It would be tremendous, if I may, Congressman, to have Congress pass legislation that would ensure paying people for their work if they are ill, because it's no fault of their own, and they're ill because they're ending up taking care of us.
Yeah, we're absolutely trying to get that coverage, and that is in the legislation that we passed a couple of weeks ago that's sitting over on the Senate side. And hopefully in these next 2 weeks when we're back in Washington, D.C., legislating that we will get another COVID-19 bill passed. Again, if you have any questions, go ahead and press 0. If you'd like to get on our email list, which is the most efficient way for us to get the latest information out, go ahead and press 1. Let's go to the next question. We have a question from Robert. Robert, are you on?
Yes, sir. Robert Hansey here, retired intensive care RN, somebody who visits the CDC website at least once a week. I am terribly concerned with respect to this new rule that the Trump administration has put forth that the information has to go to HHS. I went to CDC today. Information is not there. It's about 10 different changes in the website to find indirect information at the HHS. The current administration appears to be following the path that Florida did. When the numbers got bad, the governor shut down the reporting. Do you have any concerns that we're entering a political situation with respect to the Trump administration trying to hide numbers from the American citizenry?
You know, Robert, I feel exactly the same way you did. I'm very concerned about it, and it's exactly the wrong thing to do right now. We need transparency. We need accurate case rates. We need accurate data, and that will help us fight this virus. Hiding the data doesn't make the virus go away. Not accurately reporting the number of cases, the number of hospitalizations, the number of ICU beds, that is going to make all of our jobs so much harder. So, was on a call with my colleagues today in Washington, D.C. to see what we could do legislatively to try to block the administration from doing that. And if there were, whatever tools we have as a separate branch of government to, continue to make sure that data is publicly available. And CDC, that is their job. They're our public health arm of the United States government. And again, I share your concern that this could be an effort of the president to hide the data because he doesn't like the numbers. So, we are going to do everything we can, including perhaps going to court if we have to. But we need that data, and Dr. Bielenson needs that data.
Yeah, and if I may, what we need is bolstering of the CDC, not cutting it down.
Great. Let's go to the next question. We've got a question from Kevin. Kevin, are you on?
Yeah, I'm on. It takes a couple minutes to get brought in. My question is, I'm really concerned, and the gentleman on the phone got into it a little bit, but I'm really concerned about the future of our supply chains in regards to supplies that we'll need medically to get through this pandemic going on for probably a year plus. There's going to be other things like syringes and the vials that they go into, as well as reagents. And I am not impressed with the securing and appropriating and mustering whatever resources we can to maintain the supply chain, which is going to be vital. I don't see it happening, and I'm wondering what you and your colleagues could do, around the administration to try and keep this all more secure.
Right. Kevin, that's a great question. So initially, we continue to push the president to use the full powers that the Defense Production Act gives him to really mobilize our own capacity here in the United States to produce PPEs, the face coverings, the N95 masks. Locally, we've had some of the distilleries step up to produce hand sanitizer, and as Dr. Bielenson said, sounds like there's a local company stepping up to help with the testing capabilities. So I do know American businesses are starting to step up. You hear, about companies retooling to, provide the PPEs and so forth. So it's not technically difficult to do. Part of the challenge is a lot of the raw materials that go into making the PPEs don't come from the United States. Unfortunately, they come from China. And we are trying to build redundant supply chains as well. I'm on the phone, and it's not just the United States, because the Europeans were also reliant on China, et cetera, and we realize how dangerous having just a single source is. So, that is a big part of what we do. I do all day in sense is trying to figure out how do we get these supply chains ready, not just to address the virus today, but we know, as Dr. Bielenson pointed out, when we have that vaccine, we'll need to have, if it's an injectable vaccine, we'll need the vials to transport the vaccine. We'll need the syringes. We'll need the global health workforce to distribute the vaccine. And, again, this is a monumental task. And we have to work on those issues today so when we get there, we're ready to hit the ground running. But, yes, the supply chain issue is one that we've got to deal with today, but then we also have to fix for the future. Remdesivir, a medication that is helping us treat COVID-19 patients, we're seeing in short supply because, again, a lot of the raw ingredients, come from overseas. I don't know, Peter, do you want to add anything?
Yeah, the Defense Production Act is absolutely crucial, and the fact that we depend on China for some of this really argues against the president bashing China all the time. It would be nice if maybe they would treat things a little bit more equally, and so that we could get the stuff from them. But I'm very worried about the supply chain. Let me just give you a brief background on the viral test and what's needed. What's needed are four things: a swab, which is where you get the swab from the nose. There's shortages of that, but it's mostly you can get around that right now. Secondly, there is a test tube, the transport media and tubes, which is effectively a test tube in which you put liquid and you put the swab in. And then there's the reagents, the chemicals that are necessary in the machines to come up with a viral positive or viral negative. There are shortages in all four components. And what's happening right now is that the locals are literally having to go out and fend for themselves. So we went out and found this lab that also come to us, and otherwise we would not have laboratory facilities to be able to do the lab tests that are necessary, that are even partially necessary. The state is trying as best it can, but it's put out a list of 40 labs that you can maybe try out if you want to. But instead of prioritizing the big labs, the Quest and the LabCorps of the country, this administration has not done that, and it's really, really taking a toll. So I'm very emphatically encouraging the Congress and whatever administration is in place in the beginning of the year to really step up on the supply chain. It's a huge, huge problem.
Yeah, no, absolutely. And we're doing everything we can, working with FEMA and others in the administration to really at the federal level coordinate this so you can get supplies, limited supplies to the places that need them at that moment. New York was a hot spot in April and May. Well, that's when we needed to move supplies over there. Now, California, Arizona, Florida are hot spots. We ought to be coordinating that at the federal level and not just being 50 individual states, but being the United States of America. And
yes,
we really need that leadership right now. Let's go to the next question. We've got a question from John in Elk Grove. John, are you on?
I am, thank you. What is being done to accommodate the next spike, which may be in November, December, around the holidays, when we're finding out that people's immunities who have had this COVID are not as sustainable as we thought?
Great. I'll start at the federal level and share how we're thinking about the fall and winter, and then kind of push it to you, Peter, to talk about how
sure.
The local communities get. Most of us that spend our time thinking about this, and I talked to Dr. Fauci and Dr. Redfield at CDC and others, think this is going to be a tough fall and winter because we know the virus will continue to circulate. We know people will be going indoors as it gets colder and wetter. We also know that is when the influenza virus, the flu, is also going to circulate. And we're very worried if you both have COVID-19 and the flu circulating simultaneously. We're already seeing the stress that our hospitals are under, our doctors and nurses. And if you have both going at the same time, this could be a very difficult fall and winter. And so we're, I mentioned earlier, working with the CDC to make sure we get additional manufacturing capacity and doses of influenza vaccine, looking at how we can make that flu shot as readily available and easily available as possible, because that is absolutely one thing we can do in the fall and winter to try to reduce our influenza rates. But the other things we can do to reduce flu rates are the things we're doing to try to reduce transmission of COVID-19. Wear your face masks. We can't say that often enough. Wear your face masks. That'll reduce the spread of both COVID-19 and the flu. Practice really good hygiene. Wash your hands, use hand sanitizer. That'll help reduce the transmission of COVID-19 as well as the flu. Practice physical distancing. That will help reduce the transmission of COVID-19 and the flu. Those are things we can do right now to hopefully put us in a better place when we get to the fall and winter. Peter, would you like to add talk about?
Yeah, I agree with all of that. The only thing I would add is that the flu shot, just so people are well aware, I don't mean to sound paternalistic or whatever, but the flu is the influenza virus. The coronavirus is the coronavirus. They are separate things. But the reason that we care about getting people immunized against the flu is that obviously it keeps the number of hospitalizations down and the number of ICU visits down. The more people are immunized, which allows us to use the facilities for the coronavirus. The flu vaccine is usually 40 to 60% effective, but that means at preventing the spread of the virus, it's almost always at least partially protective in terms of giving you a less severe case of the flu. So if there's any year, as the Congressman was saying, if there's any year that people get flu shots, it's this year. Everybody should get a flu shot.
Great. Thanks, Peter. We've got a lot of questions. We may not be able to get through everything, but we've got a question from Nancy. Nancy, you're on.
Hi, Dr. Bera. I have a question. If you don't have any symptoms, should you go get tested?
Peter, do you want to take that?
Generally, so if you know that you've been exposed to someone with the virus, you can either get tested or quarantined for 14 days. And if you've been exposed, it means a serious exposure, more than 15 minutes within 6 feet without a mask, basically. That's sort of the easiest thing to measure. If you're just an average person and you're asking if you're asymptomatic and you don't have any known exposure to people, you don't really need to get tested, especially now when we don't have adequate number of testing.
Yeah, again, I think that's a really important point. If you haven't had any exposures or any known exposures and you have no symptoms, getting the diagnostic test, especially when we're having this test shortage, doesn't make sense. But, Peter, do you want to go through what an exposure is again? I know you just went through it, but just to make sure everyone knows what that means.
The exposure in general, kind of in a nutshell, is if you've been exposed for more than 15 minutes to someone within 6 feet, and often without a mask, that would be considered a significant exposure. So if you're walking past someone when someone jogs by you and you're walking by, the chances are very small that you're going to get any kind of significant exposure. Whereas if you shared a cubby, you're next door in the cubby to a person that was at your workplace, then you and he spend a lot of time talking back and forth without a mask, less than 6 feet apart, that would be a significant exposure.
Great. Thanks for that. Got a lot of questions. Let's go to Jim in Rancho Cordova. Jim, are you on?
Yes,
Jim,
I'm here.
Oh, great.
My question is about the school openings. I saw that Sacramento schools are going to be opening online in the fall, and I just had a couple of questions about that. One is, what are the criteria and the standards that are used to make those decisions? And two, how is that coordinated throughout the various school districts within the county?
Very good question. So if you want me to take this on me?
Yeah, go ahead, Peter. You can take
Okay, so the school districts are united in this. They each have the ability, the 13 school districts of Sacramento County Office of Education, which oversees all of the school districts in Sacramento County, encouraged the counties to the unified school districts to all have basically the same guidelines, and they agreed that it will go till October 2nd with online, and then they'll make a decision shortly before that about whether to go back in person or not. The decision was made by the school system with consultation with us, the health department, and the two main areas that were of significant concern were obviously the increased number of cases and we can come back to it, and I'll come back to it in a second about how risky that is to kids or not. And second is the lack of testing. So here's a typical situation that happened at the end of last school year before schools went out. Johnny gets tested positive for the virus. He has 9 people that he's a 6th grader. He has 9 kids that he's significant exposure to, as well as the teacher. Now, you could argue that the teacher and the kids should go out and quarantine for 14 days and they don't need a test, which is actually the case, the guidance. But you know full well, and in fact we know full well because of our experience last year, that every single parent is going to demand that their kid gets a test, as the teacher is as well, which is exactly what happened last year, and we have nowhere near enough testing to be able to do that. And since the number of cases has gotten so large, and even though for the average teenager it's generally not a terribly dangerous disease, nonetheless we have 700 or 800 cases of teenagers, and they are prime spreaders because they tend to be asymptomatic, but they can still shed the virus and spread it to others. So it was a combination of availability of testing and the number of cases.
Yeah, and if I were just to add on to that, Peter, I talked to some of our superintendents yesterday, and everyone realizes and has a desire to get our kids back into the classroom and so forth. But as Peter said, first and foremost is keeping our kids safe, keeping the teachers and staff safe, and helping get ahead of this pandemic. And without adequate testing capabilities and tests that you can get back in 24, 48 hours, the reality is we would be opening and closing schools.
Exactly.
And, it just didn't make sense. And I think now, if at least for the short term, as we know we're going to be doing distance learning, we can start to think about what's the best way to get the right equipment to kids, to the best way to teach those kids. We can work with our teachers to work on the best methods. And then for those parents that do have to continue to work, we can also start to think through solutions of, okay, well, how do we care for those kids that have parents that may have to leave the house to work? And we can start thinking about solutions for some of those challenges. We've got a lot of questions, so let's go. We've got a question from Reed. Reed, are you on?
Yes, I am. Thank you. And this is really more for the esteemed public health official. This is a business question. In California, as you know, the recent order has been to close barbershops and salons. And yet cannabis dispensaries, restaurants can go outside. And we have criteria that we've been, had to follow, which is we mask, our client masks. We take a temperature outside. Nobody can wait inside. We disinfect everything when the client leaves. Now, according to the Board of Barbering and Cosmetology, there's some regulation that prevents us from moving outside. And I'm wondering, does public health have any effect on the Board of Barbering and Cosmetology, who's aware of this, but doesn't seem to be budging, because we are small businesses and we won't be around much longer?
That's a great idea. I thought when you said the esteemed public health person, you were going to attack, but instead you gave a great idea. I appreciate it very much. I had not thought of that. I had not been aware of that, but I will make sure I deal with it tomorrow.
Great. And
we may well have that. We may well have influence on that.
Yeah, I actually think that's a great idea as well, Reed. So thank you for bringing that up. Let's go to another question. Donna, you have a question? Are you on?
Yes, hi. Thank you for taking my question. I have a 20-something-year-old son, and he was up in North Lake Tahoe over the 4th of July weekend with friends. And, of course, he's always been very careful, but the people that are around him may not be so careful. And they went to the beach and, jet skiing and whatnot. But when he came home, he went in and got tested. He doesn't have any symptoms, but he was tested on the 7th. We still haven't received the results. when he first came home, we said, we really don't want you to come in here. And can you stay with your friends, for a couple weeks until we know that you're cleared? So he did for about a week, but then he needed to come home and get clothes and whatnot, so he's been wearing a mask inside the house. What else can we do to stay safe, and how do you handle these 20-somethings that are out there? Some of them don't believe in wearing masks, and some of them do, and there's a lot of exposure in that age group. So how do
So you handled it quite well. He was tested the 7th. It's already the 16th. So this is making my case, and that it takes a long time for it to get back. By the time he's 2 weeks out, asymptomatic, after he has been exposed, he's good to go, and as are you. So I think you're handling it appropriately. If he gets symptoms, then you guys should get tested, or at least quarantine and get tested. But if he does not show symptoms by the time 2 weeks is up from his exposure, you guys should all be fine. In terms of the bigger question on what do you do about 20-year-olds, I'm not sure. We're coming up with more campaigns for young people. It's been interesting, if I can just take a quick minute, in that the first 20 weeks of this outbreak, of this epidemic, has been predominantly affecting older people, as well as certainly the deaths, but in addition, the number of cases was trending towards the majority of older people. It's now flipped almost completely to 70% younger people. And so we've realized that we probably should have realized that we got to do more campaigns for younger people. So we're going to be doing things like Instagram and Twitter, et cetera, instead of Facebook, which apparently is only for 40 and olders. But we're launching some new messages in the next week or so. So hopefully that'll do something. But your point's very well taken.
Thanks for that question, Donna. Peter, I know you've been really generous with your time. We still have a couple more questions. Can we keep you on for a little bit longer?
Sure.
Okay, we've got a question from Susan in Folsom.
Hi, Ami.
Hi, Susan.
I'm calling from Folsom, and I first of all, I'm so grateful for you to do these phone chats with us. And I'm just concerned because I don't know what happened when we were able to bend the curve here with Governor Gavin Newsom. And, even the hot spots like New York, are doing pretty well now, I guess. But my question is, how do you get people to do what you want? People and places and things are hard to change without some kind of enforcement. Now, I know you stated earlier you were going to talk about education, which is good. That's great. Now, I'm a teacher myself, and I explain to the kids why I have the rules I do. And it's usually for their benefit. But how did we go from what we were back in, say, April or May to what we're at now?
Great.
Because that was
yeah. Thanks for that. Yeah, thanks for that question, Susan. Peter, do you want to, because we did a remarkable job in March and April in terms of just knocking the case rate down, and we were the best in the country for large metropolitan areas, and then how we ended up here.
Yes, I'll give you, first of all, actually our numbers are, although the numbers sound large, 6,395, we actually are still below certainly the average number of cases on a per capita basis, so that's a good thing. But secondly, how we bent the curve is that we had a very early on stay-at-home orders, A. B, people clearly followed them. And C, because people clearly followed them, we had a tiny case rate, if you will. A tiny percentage of Sacramento County residents had the virus, which puts us at significant danger when what happened, which was message fatigue and cabin fever, particularly in young people. So when they're message fatigue, people kept hearing the same thing, and which, although we keep saying it, it really is important. And they were getting cabin fever, and the weather got nice, and so they all went outside or had parties, or in like that house party that the woman was describing earlier, and people spread the virus. And because we had such a small level of we didn't have herd immunity. We had a tiny level of herd immunity. Virtually everybody that was exposed to someone who was ill got ill. So that's why we've had this gigantic increase over the past 3 to 4 weeks. The hope is that we can continue to re-bend the curve, if you will, with our new kind of orders, where we're sort of going back most of the way towards where we were back in April and early May, and basically have open those areas that are critical, like grocery stores and pharmacies and a few other things like that. But if people could kind of stop, instead of going to the market twice a week, go once a week, and stay at home as much as possible, and follow the masks and the social distancing and the hand washing, but particularly the mask. It's appearing, as Congressman Bera talked about earlier, more and more of the data is showing that wearing masks on both sides, or both people, the client and the staff or whoever, makes a real difference in spreading the virus. So if we can keep those things going and keep the gatherings down, I think we can bend the curve back down. If we don't, it's going to be a problem in the fall.
Great. We've got time for a couple more questions, and unfortunately we're going to have more questions than we're going to have time to do. But if we didn't get to your question, if you could stay on the line after we end the telephone town hall and leave a recording, leave your name and how we can get back in touch with you, either an email address or a phone number. I'll have my staff go through that and certainly try to get an answer to all of your questions. Also, if you're not on our email list, that is the best way for us to communicate with you in real-time information. So press 1 and we'll add you to our email list. And then let me give out my district office phone number as well. It's 916-635-0505 if you have any questions. Again, we're all in this together. Let's take a couple more questions. We've got a question from Kelly. Kelly, are you on?
Hi. I was wondering your feelings on gloves. I personally think that they're disgusting now that they have white ones and people leave them on all day. When a doctor checks you and pulls them off, and that's fine, but people are wearing them all day long, and I see them black, and I'd rather have you wash your hands, and I wish people would promote more. You had said it earlier, personal hygiene, than promoting gloves.
Peter, what are your thoughts on gloves?
100% agree. When we talked about the servers at restaurants, we actually encouraged them, instead of wearing gloves, which they often would forget to switch from person to person, but instead to wash your hands regularly and use hand sanitizer. That clearly is the better way to go. You're 100% correct.
Great. Let's try to get to a couple more questions. We've got a question from Stephen. Stephen, are you on?
Thank you, Congressman Bera, for taking my call. I appreciate everything you do for us. I just have a question about what kind of protections they're putting in place for the essential workers, like the farm workers and the grocery store workers and the warehouse workers. And
thanks for that question, Stephen. Peter, do you want to take that initially, and then I can follow up?
I think initially, I think it really is something that's got to be dealt with by Congress in terms of protecting these folks' ability to make money. I mean, and I know Congressman Bera clearly supports this kind of legislation, but if we're going to have sort of the quote unquote bailouts of the big airlines and others, where we can pay people to have people off of work, we should be paying people that allow people to miss work who've gotten ill. I know you're talking about PPE as well, but I think that's a crucial thing, is making sure that people are taken care of.
No, absolutely. We and what we're pushing at the federal level is, to make sure folks have that ability to have sick leave because again, if people feel like the only way they can pay their rent and they're having symptoms is to show up to work, that's not going to help us defeat this virus. Right. So we've got to make sure people have sick leave and have the ability to keep getting paid. We've got to make sure people that have family medical leave, because if their loved one or their child is sick at home, someone's going to have to care for them, and we don't want that. So that's something that we're definitely pushing. We also are, as Peter mentioned, Dr. Bielenson mentioned, making sure that folks in these small businesses and farms have the resources and the funding to get the personal protective equipment that they need, to put the plexiglass up that hopefully helps protect those essential workers and so forth. And in the HEROES Act, which we passed out of the House a few weeks ago, and again I hope the Senate takes it up, we also did want to bump the pay for essential workers and give them a bonus, because they're out there exposing themselves and putting themselves at risk. So we do appreciate everything that they're doing, and it's incredibly important to do everything we can to keep them safe.
And when they're
go ahead.
Sorry, one quick thing. When you're wondering why other countries are doing so well, it's related to very much what Dr. Bera was just talking about, which is they tend to have universal health coverage and universal health protection, if you will, and that we don't have in the United States of America. So a lot of the folks who are getting sick are the uninsured and the underinsured who can't afford to go back to work, who can't afford to stay home from work.
Right. Thanks. Well, let's take one last question. And again, if we didn't get a chance to get to your question, please do stay on the line, and you'll have a chance to leave a recording, and we will get back to you and try to answer the question and get you the information that you were looking for. Again, there's a question from Anthony. Anthony, are you on?
Yes. Thank you for taking my call, Congressman. Really appreciate you putting on these conversations. I have a question about legislation. I was just wondering if you have any updates on the status of the HEROES Act. I know it passed the House in May, and thank you for voting yes on that. But I haven't seen anything in the Senate, and the last thing I saw in the news said there could be weeks of negotiations before anything is agreed upon, and that was just really heartbreaking because people need support, immediate.
Anthony, I couldn't agree with you more. So we passed the dates are all blending together, but I think we passed the HERO Act at the end of June or mid-June. So it's been a couple weeks that it's been over at the Senate side, so we'll go back in session, and the Senate will be back in session on Monday, and we'll be in session for those 2 weeks. We're willing to stay into additional weeks to get this done, because we know the enhanced unemployment benefits that many people are relying on to be able to pay their rent, to put food on their table. That all runs out at the end of July, and we've got to extend that. Extended unemployment benefits. We've got to extend that, because again, we know we're going to be grappling with this virus, for the foreseeable future, at least the rest of this calendar year. So that's what we pushed in the HEROES Act. We do understand that Senator McConnell, who leads the Senate, is working on a package, and we don't have time not to extend these benefits. Otherwise, there's already so many Americans that are having trouble just putting food on their table and keeping a roof over their heads. And that's not who we are. That's not the country I believe we are as the United States of America. I believe we ought to look after each other at this unprecedented time. And Peter mentioned the billions of dollars that went to big corporations, to the airlines and others. And they didn't cause this virus, but at the end of the day, a country is made up of its people, its citizens, and we've got to take care of the people here in America, get them the health care that they need, and get them the resources just to take care of the basics like food, shelter, and clothing. And that's what we did in a bipartisan way back at the end of March. That's what we did in a bipartisan way in April and May. And let's do it again, because we're not nearly done with this pandemic and out of the woods here. So it's my hope that in the next 2 weeks we pass the HEROES Act and we extend many of these benefits that Americans are depending on. So, Peter, do you want to add any closing comments?
No, I think you're right on.
Great. Well, again, I appreciate the folks staying on this call. We will get through this, but we will get through this if we stick together, if we look after one another, if we do what we can to protect one another and protect ourselves. And right now, that is, when wearing a face mask when you're going out, protecting yourself through physical distancing of 6 feet, and practicing good hygiene. And as Peter said, avoiding those indoor gatherings and really staying at home. And if you do have to have a gathering or chat or meet with someone, certainly trying to do that outside with physical distancing. So again, we will get through this if we work together, if we look after one another, if we keep the politics out of this and just do what is the sound science and healthcare advice. And I think if we do that, we'll come out stronger on the back end as a stronger community, a stronger country, and hopefully a stronger world. God bless all of you. Be well, be kind, and let's be safe. Thank you, and have a wonderful night.